This evening, Streetside Medics launched in Melbourne, providing free healthcare for homeless people. It's the brainchild of a former Young Australian of the Year, Dr. Daniel Nour, who joins me now. Daniel, you've been running this operation in Sydney, in New South Wales, since 2020. Tell me why this service is necessary. We've got universal healthcare, we've got bulk billing. Why do we need to have the services you provide out on the streets helping homeless people receive medical care?
Yeah, Rita, I could talk about this for hours, to be quite honest with you. There's so many reasons why. But to start with, there are a number of significant and challenging barriers that limit access to healthcare for people experiencing homelessness. I am one of the people that believe we have probably the best healthcare system in the world. But that healthcare system is inaccessible for so many people. And for people experiencing homelessness, it's even harder. And the barriers are the costs involved, transportation required, the level of documentation and Medicare and ID. It's the notion that you have to be at this place at this time, for this duration, at this hour. It's previous negative experiences, it's stigma and embarrassment, but also it's health priority. For people experiencing homelessness, they're more likely to be concerned about when am I getting my next meal, shelter, security, companionship, and not why am I short of breath or why am I having chest pain.
So are you finding people have not had things that could be easily remedy checked and they grow into much bigger issues for them?
Absolutely, absolutely. So primary healthcare or preventative healthcare is really happening. We see people that have had diabetes for 30 years and presenting with all the complications that could have been prevented. Or people with hepatitis C that's at the acute stage that can lead to cirrhosis but hasn't been caught. And so really what we try and do is provide opportunistic healthcare. We partner with local community-based organisations that provide food or shelter to people experiencing homelessness, and we park alongside them. Here in Melbourne, we've partnered with the Salvation Army in Bourke Street. They've been providing a fantastic service for Melbourne for many years. Over 500 meals a day will be served. We'll park alongside them, and we'll have our van there, which doesn't require Medicare, doesn't require ID.
So these people don't need any ID or Medicare or an appointment, or you go to them where they are.
Exactly.
And we've seen, particularly in this city, in Melbourne, the homelessness problem grow. Is it getting worse, and are you finding it difficult to meet the demand that's there?
Yeah. Look, there is no doubt in my mind that homelessness is a pandemic across the world. This isn't an Australia-only problem. You go to America, you go anywhere.
Yeah, but we're a wealthy country, so you would expect us to...
We are. And you know what? Australia's homelessness population is growing at a very concerning rate. Melbourne, unfortunately, is not any better. There are, the data that we have on homelessness is relatively poor and it's old. We say that 30-odd thousand people experiencing homelessness in Victoria. I would bet it's probably more than double that. Are we struggling to meet the needs? Look, we take our clinics to the areas that need it the most, and we don't turn anyone away. And we slowly grow our services to make sure that we can meet the needs of the community. Are we reaching the full potential? Certainly not yet. But that's my biggest goal, is making sure that Streetside Medics grows across the nation to be an organisation that can meet the need of the Australian community.
Now, last night at the official Melbourne launch, the Prime Minister was there. He is a big fan of what you do. He introduced you and spoke glowingly about your work. He's recently moved Claire O'Neill to the Minister for Housing and the Minister for Homelessness. Do you have faith she'll be able to do something significant in this area? I do. I think the more eyes and the more people working in this space, the better. One of the things I am passionate about is a Homelessness Commissioner. And I think that it's absolutely essential and it's needed now. And the reason I say that is there are so many organisations that are doing amazing work, but in bubbles, in silos. There is collaboration, but there isn't unity. We aren't one body working together to improve the space. And so I think that, I certainly welcome the idea of a homelessness minister, and I'm sure Minister Claire O'Neill would do a fantastic job. But it would be remiss of us not to consider putting a homelessness commissioner. And I would say that it needs to happen sooner rather than later. When you speak to the Prime Minister about this issue, what is his response? What are you seeing from the federal government and the state governments about tackling this crisis?
Yeah, so the federal government have been strong supporters of Streetside Medics. For the last 3 years, we've received funding from the federal government, and as you saw last night, the Prime Minister has vocally said that he will continue to support Streetside Medics and ensure of its growth. We haven't seen as much support from the state governments yet, but I have no doubt that there'll be appetite for that, and we're working with the state government to make sure that we can meet their needs and work on solutions together. So I think the appetite is there, and I think that we have proven that a model like Streetside Medics works. And we have proven that when you collaborate with other organisations, you can do great things.
Absolutely. And you are doing amazing work. You're literally saving lives out there. What is your message to people who come across this problem and they really don't know what to do to help?
Yeah, so I think the number one message I would give in those circumstances is that is a human being that is asking for help. You'd be surprised how many people will walk by. Someone will say, "Can I have $1?" and they'll walk right by them. I've spoken to so many people experiencing homelessness, and they tell me how demoralising that is. The fact that they are a human being asking someone else for help, and so many people lack to even recognise that they've asked. If someone was walking and said, "Excuse me," you'd stop. They're no different. So I think that the number one message I'd have is stop. Stop and say, I'm so sorry, I don't give money out, or I'm so sorry, I don't have any cash. I'm so sorry, I can buy you a meal, but I'm not comfortable giving you money. But stop and have that conversation and get down to their level. Acknowledge them.
Yeah.
That would be the most important thing. And you'll be surprised what a friendly ear, a supportive or encouraging few words can do to someone.
Dr. Daniel Nour, thank you so much for your time this evening.
Thank you, Rita.